Hi, it's Kent here. I'm student of LPU Batangas, so I'll be going to demonstrate with you about the bandaging techniques with the splint. So stay tuned. What is splinting? Splinting involves applying a supportive brace or a device to immobilize a limb, typically used for fractures, sprain, or other injuries. Demonstration on closed fractures forearm with splint. This technique is to immobilize the closed fracture forearm. Requirements: padded splint, extra padding, 2 narrow cravat, and 1 open face cravat. Demonstration. First step, check the pulse, motor reflex, and sensation. Second, give the appropriate size of the splint. Third step is place padding in the palm area so that the hand can assume its functional position. Fold 1 narrow cravat into the 2 equal parts. Insert one end of the folded narrow cravat into the hole at the apex part, securing that the injured distal joint is laid on the padded splint. Then make a square knot, insert loose end, make sure that the knot do not directly touch to the skin. Repeat the steps by using the other narrow cravat to secure the proximal joint. Then apply an arm sling to further immobilize the injured limbs. And the last part is check the pulse, motor reflex, and sensation. Open fracture forearm with splint. Requirements: dressing, padded splint, extra padding, 3 narrow cravats, and 1 open face cravat. Demonstration. Step 1. Check the pulse, motor reflex, and sensation. Step 2. Place a dressing on the wound and apply pressure. Step 3. Apply a narrow cravat diagonally on the wound with the apex as the point of reference. Roll the ends of the bandage alternately several times, with one end going to the distal side and the other end going to the proximal side, leaving an allowance on the both ends. Pull the end upwards, then make a square knot on the top of the wound, then insert the loose end. Given the appropriate size of the splint, place a padding on the palm area so that the hand can assume its functional position. Fold one narrow cravat into the two equal parts. Insert one end of the folded narrow cravat into the hole at the apex part, securing that the injured distal joint is laid on a padded splint. Make a square knot that insert loose end. Make sure that the knot do not directly touch the skin. Repeat the steps by using the other narrow cravat to secure the proximal joint. Apply an arm sling to further immobilize the injured limb. The last part is check the pulse, motor reflex, and sensation. Cuff sling. Demonstration. Place the narrow cravat diagonally with the apex on the top of the forearm. Second step, wrap the distal end and insert underneath the bandage. Third step is wrap the proximal end and insert underneath the bandage. Fourth step is pull both ends gently and wrap the both ends around the neck. Lastly is tie both ends together with a square knot. Then insert loose end. So those are some of the bandaging techniques that used in first aid. Thank you.